Doctors of Reddit. What is your most surprising I can't believe I need to have this conversation with an adult story? Paramedic here. Was driving with my partner and patient in the back. Patient was fine. Patient's skeezy boyfriend was riding in the front with me and apparently saw a golden opportunity to ask a question that had obviously been on his mind for some time. So when cats and dogs eat grass, that means they have cancer, right? Me. No. No, it does not. Made for an awkwardly silent ride the rest of the way. Hahaha. WTF. And really, why did he even assume a paramedic would know whether or not animals have cancer? Well, it looks like she is about 30 days pregnant. Congrats. How can she be pregnant? She is only around her brother. Actually, they don't follow the same moral code as you or I. Veterinarian. My fragile sanity wishes you had started with veterinarian lol. Not a doctor yet, but an ER tech for 2 years. Mom comes in with her baby plus 2 more older kids. Complains that the baby hasn't pooped in a while and won't stop crying. As I'm settling them in with one of the nurses, the baby is bawling. Like opera singer lungs bawling. Suddenly mom whips out a white plastic shopping bag and sticks an end in the kid's mouth. Says this is the only way she stops crying. Nurse and I share a look and immediately order an emergency x-ray on the kid's stomach. Turns out she had ingested a good amount of these bags and it was blocking up in her stomach. Big deal. Potentially life-threatening. When we confront the mom about her baby feeding habits, her only words of defense are, well, I checked all over the bag and I couldn't find anything that said non-edible. TLDR. Mom had been letting her baby teeth on plastic bags because she didn't know they weren't edible. God hope this mother lost custody of her children. That the 30 cups of coffee he was drinking every day could possibly be the cause of his chief complaints of anxiety and insomnia. He said he was not willing to give this up or try decaf. 30. Man, I'm such an amateur. Your heart thanks you for your amateur ways. This will be a long story. When I was an internal medicine resident, I came across a very nice 50-year-old Dominican lady. She was well mannered, but one could tell she was not the sharpest tool in the shed. As I was prepping her chart for our first visit, I noticed that she'd been seen by every single digestive disease MD in our hospital system. Not only that, she'd had every single procedure in the book. Ranging from endoscopies up both holes and culminating in an exploratory laparotomy you're open up to basically look inside you when we have no clue what's going on. All of this because for years she had one single complaint. She reported severe gnawing pain in her stomach. At this point I should mention that she was Spanish speaking only. Not only that, she had a very heavy Dominican accent. And I was the first Hispanic doctor to ever see her. My first language is Spanish and even I had difficulty understanding her. So she comes in and after exchanging some first time pleasantries I politely ask her how she's doing. Sure enough, although she was smiling and said she felt well, she pointed at her belly and said it was biting again. And asked for the cream to kill it. At this point I got intrigued. Her medication list only mentioned a cream used for herpes breakthroughs. The previous fellow only mentioned in his note that in every single visit she only asked for the cream and nothing else. When I asked what she meant by the biting and what she intended to do with the cream, she very calmly tells me she intended to stick the cream up her ass in order to kill the bird living inside her. After delving more deeply into her story, it turns out she didn't have a medical condition. Ever since she was a little girl, she believed that after eating whole quail egg, the bird had spawned inside her and gnawed away in her insides whenever she was very hungry. After a short visit to psych, she was diagnosed with a somatic type delusional disorder. No amount of medication or psychotherapy will cure her, but she was still a fully functional mother of 2 who paid her taxes and had 2 part-time jobs. I reached out to every digestive disease doctor in our hospital system once more to make sure she never receives an inappropriate invasive intervention. I've been following her now for 3 years and she's happy as one can be, considering she has a bird living inside her. TLDR. Lady complains of pain in her belly. Worst case of lost in translation ensues. Gets very invasive medical procedures. Turns out she's just cuckoo. While in dental school, my friend pulled out several bombed out technical term teeth on an adult male. After the procedure was finished and post-op instructions were given, the man asked, "So when should I expect my new teeth to grow in?" He was serious. My S.O. is a med student. He helped to diagnose a 40-year-old woman who finally sought out a doctor after having open, festering wounds on her entire torso for over a year. The open wounds only appeared after more than a year of painful, visible lumps on her breasts. She had never sought treatment prior to this. S.O. had to inform her that her entire body was riddled with cancer, that there was no treatment to help her, and that she would be dead very soon. Her sister, who was there the entire time, began loudly proclaiming what a shame it was that nothing could ever have been done, and that hopefully someday we would be able to detect cancer sooner. S.O. watched the doctor explain that pretty much any other woman in the country would have gotten effective treatment at the first sign of the lumps. This was during Breast Cancer Awareness Month. I saw a patient who was concerned because she was still lactating, despite the fact that she stopped breastfeeding her twins 2 years ago. She said, "Sometimes I wake up in the middle of the night and find my husband sucking on the breasts. He says he's trying to drain the milk for me." I had to explain to her that breastfeeding her husband will lead to continued lactation. As a veterinarian, I had a 10-minute conversation with an owner explaining which side was the dog's left side. I worked at a vet clinic when I was in high school. One day a vet came out of an exam room and asked me how to tell whether a puppy was a girl or a boy. Thinking it was a joke or a trick question, I said, "You flip them over and look. Right?" The vet sighed and walked away. Apparently this client, who fancied herself a breeder multiple litters at this point, expensive breed, had asked dead seriously how you tell if a puppy is a boy or a girl. I had to explain to a client that just because his puppy had nipples did not mean it was a girl. Medical assistance to a cataract surgeon here. If you've peeping sleep in your contact lenses long enough, they will fuse to your eyes and will need surgery to have them removed. Yes, you can go blind from this. For the love of God, don't sleep in your contact lenses. Got placed doing a rotation in the orthopedic floor of a big hospital in a rural area of Southern California. I was doing my rounds and saw a patient out of bed and walking around the floor following a knee replacement. She had a cane in her hand that she was carrying like as a soldier would carry a rifle. I asked what she was doing and what she thought the cane was for. She replied she thought the cane was for pushing people out of her way since she's now handicapped and it wasn't to help her walk on her post-op knee. This is the first response that genuinely made me laugh out loud. I can just imagine some cranky old woman swatting people out of her way. I have a cranky old woman story for you. My mom worked at a nursing home as a cook. They ended up having to take away the electric wheelchair of a resident that was 107 because she kept running people over when they made her mad. She was my mom's favorite resident. Talking to the children powers of nursing home residents about vaccines. Most will just sign the flu shot form. Some believe it will give their 90-some grandpappy autism. Pharmacist. But comment still relates. Had a lady call in complaining that their husband's Viagra wasn't working. I then went on to explain to the patient's wife that in order for the medication to work, The patient needed some sort of stimulation. The lady just screamed aloud "ME" and then hung up the phone. Still my favorite Viagra story.